better sleep, sharper focus, a healthier life. It all starts with how you breathe.
Welcome to the No One Told Me, the Airway Health Connection, the untethered way, where better breathing meets better living. I'm Dr. Maggie Graham.
I'm Dr. Liz Turner.
We're the co-founders of Untethered Airway Health Center,
on a mission to help you breathe freely and live fully through proactive airway health.
Whether you're a dentist expanding your airway expertise,
or a family looking to sleep and breathe easier,
you're in the right place.
Each week, we'll bring you bold insights, real-world stories, and expert tips.
All to help you take control of your airway health. Because when you breathe better, you live better. Let's get started.
Hi, everybody. Welcome to No One Told Me, the Airway Health Connection. I am Dr. Liz Turner. I have a very special guest and talking about one of the topics that's near and dear to my heart, functional medicine, Dr. Ben Busch. I am so excited to have you here. I know that everybody listening to this has a reason to do so. Maybe it's for themselves, maybe it's for a family member. But we just would love to hear about your background. And this is the way I phrase you to parents. I go, he has so many tools in his toolbox because his background is so extensive. So we'd love to hear about you, what you do, your practice, who you help. Let's get started.
Awesome. Thanks, Liz. I appreciate you having me. And it's great to connect with you as always. I have a checkered history, like many of us, where I grew up in a very complementary-minded household. My parents lived a bunch above a vitamin store growing up. So they were really into nutrition. And then my mom grew her own food. And I grew up with like a functional chiropractor who did muscle testing and had an old DO for a doctor. Ended up doing biochemistry for a major, and osteopathic medical school really showed me how to look at health from a lot of different points of view. So I get along with naturopaths and physical therapists, and I actually had my own story with needing regenerative dentistry and implants for myself. So I have a heart for more advanced surgical support, and it's just starting in the mouth. So maybe that's why, of course, we get along so well. Mm-hmm. Emergency medicine taught me how to work within the healthcare system and how to handle a lot of different things, but how to attack things from a novel perspective. And I think that was really important. I ended up getting sick myself. With nights and stress, and I had my own illnesses that I actually ended up discovering. I had a head injury. I also had a big trauma where I screwed up my chest and my back, had to get a chest tube, and had my own foray into regenerative medicine with PRP injections in my spine. And later doing IV exosomes that actually helped me. So that sort of brought me to the point where during the COVID pandemic, I was getting an MBA and working within some other healthcare institutions, and decided that I really wanted to help people with all these tools. So we started a medical practice in 2022, and it has grown like wildfire.
Well, because you're an emergency medicine doctor by trade, right? Like you were in the ER for what, 19 years?
That's right. That's right.
And I remember you saying to me once, you're like, Liz, with my background, I'm not scared. I'll put a needle in near anything. So that's the thing, is like you have a lot of access to a skill set that a lot of us don't have, and a lot of functional medicine providers don't have, just because of your true emergency medical background. And that's what's so cool about your practice, is there's so many different things that you do. I mean, you've brought in, who else is in your practice?
So the nursing operations manager is an ICU nurse. And all the other staff that are clinically oriented have at least 10 years experience. So there's no rookies at all. And you're right, we do a lot of stuff here. I like to sort of use the cooking analogy. You know, some people cook with just salt and pepper. We actually have a lot of different tools and spices here at Vivewell Health. So whether that's ozone therapy, with IV treatments or injectables, lots of peptides, lots of different nutrients and lipids. We just brought in IV TrueDose, which is custom algorithms for different disease conditions, lots of stem cell exosome therapy. So it's actually very exciting. IV methylene blue. We do a lot of different things.
Wow, that's incredible.
Yeah.
So, how do you see what you do and what I do working with airway health and sleep overlapping? There's so much inflammation in our systems, and when we're not sleeping well, when our structures aren't in the right spot, how do you see that impact our full body? Like, what are you treating day to day where you really think the quality of your sleep could help you feel better on so many different levels?
Great point. So I think we all agree that sleep is probably one of the more important things we can do as far as like restoration and repair. If we think about the catabolic and anabolic process in our body, anything that's been damaged during the hard day of life needs to be, broken down and repaired. And so the body's doing that during sleep. And so, of course, we need lots of energy production. We need good breathing because the food we eat gets combined with oxygen to make the energy that we need. So, of course, then you'd start getting into, gut principles, right? Functional medicine is a lot of looking at the GI tract with, of course, healthy choices, digesting food, then you have to absorb it. And then there's a lot of discussion on the precision use of genetics, where we inherited different genes from our parents, and so the way we use certain nutrients, methylation and HLA antigen production, and there's a lot of mental health, even neurotransmitter pathways as well. That gut part plays a huge role. I think toxins are another part that overlap between us. Dentistry is known for using a lot of toxic products, right? Whether that's amalgam fillings that had mercury, or even a lot of the cements or other things that are used in surgical treatments. Fluoride toothpaste would be another option, that's come along, where people are getting sick from high levels of fluoride, whether it's affecting their IQ or their thyroid or numerous other processes in their body. So there's this overlap of where I feel dentistry is an under-recognized, super valuable part of people's overall health. And so the way that we're choosing to support people is we've created a surgical support pathway where clearly patients, if they're going to have any treatment at all, they want fantastic outcomes. And of course, their surgeon, they want the patient to have good outcomes as well. And so we've really lined up and created a regenerative pathway where we do testing to look at the regenerative capacity. There's a number of inflammatory markers in the blood to look at that, and then nutritional levels. So whether that's magnesium or vitamin D or a lot of other things. And then even looking at hormone production, which can be stunted from a head injury or toxic loads or other things, to look at how to set somebody up for the best outcomes so that they can have any surgical procedure really have the effect that they want so that they can get back to living.
That's incredible. And I think that's the thing that we really don't always appreciate when we start to take dentistry and medicine together is how much they really do overlap. And we think about it all the time. The mouth is the gateway to the gut, but also the
Yep.
materials that we use in dentistry to fix problems that are in front of us can also have an impact. So there's always a give and a take. What type of patients do you see? Like you're seeing all ages. What
Oh
would you
yeah.
say your bread and butter? What if you had five patients today, what would be their chief complaints? Like,
I like to separate things into buckets in my head. So we see sick people, right? These are the people who are either chronically ill or they have some sort of chief complaint. They're tired. I can't sleep well. I have growing arthritis. Or they had Lyme disease or mycotoxins, or they have a long COVID illness. in the same bucket, it would also be these biohackers, right? We have the people who are like, I'm on methylene blue and I take these peptides. What else can I do? Right.
Like my whole existence. Like, what can I do to
Yeah, right. And they're like, I just
hack
want to
this?
accelerate. And we also see a fair amount of CEOs, whether that's the CEO of a household, which can just be a mom who is trying to juggle all the different things, like you got all this stuff going on, or the CEO of a big business, and so which can also be a mom, right? And so there's this is the longevity and health and wellness rejuvenation services that we do. A subset of those people, we do a lot of regenerative orthopedics,
Yeah.
where joint and spine, this is where we use a large amount of different therapies, prolozone, peptides, stem cells, PRP, exosomes, red light, shockwave, to really keep the joint and spine moving, because if people can't exercise and have the mobility that they want, they're not going to get the benefit that they want in life, right? And they're just not having any fun. And then the last part is brain patients, right? I see the brain as the crown jewel. And we have a massive tidal wave of people who have autism, PANS, PANDAS, neurodegenerative illnesses, and then there's a huge societal burden from traumatic brain injuries, which then lead to all these neurodegenerative illnesses like Alzheimer's, Parkinson's, MS, ALS. The list goes on. So our brain program is paramount, I think. And so there's a lot of overlap for patients, but that's how I separate things in my mind.
Yeah, that makes a lot of sense. I mean, the brain and body connection is so integral.
Yeah.
So, the more I treat patients, the more I see I can modify the structures, I can expand them, I can improve on tongue posture, I can work on nasal breathing. But it's not uncommon for me to say, if you're not better in 6 months, I need you to come back and have a conversation as to why. Because oftentimes I'm quarterbacking care between other providers,
Yeah.
whether that be ENT, functional medicine, manual therapies of some type. And so that's where I can assess a patient and suspect there may be other things. But until we treat what's obvious in front of us with the structures and they're not making the progress they want to make, are they
Mm-hmm.
willing to dive deeper? Because like health is a onion and you're peeling back layers all day long.
That's right.
And so that's what I talk about a lot with my patients. But the more that I see, the more that we see an impact of Lyme and mold. And I suspect a lot, similar to my son, are PANDAS patients too, because
Yeah.
then also that interferes with reflex integration and movement patterns, behavior. And I mean, I hate to say it, but I'm worried about society as a whole. Like you said, these brain patients like become body patients. So what do we do? What can we do?
Yeah. And what's I think the more you learn, the more you realize how much you didn't know,
For sure.
right? And how much there is to know. I think we have societal data where, several decades ago, autism was very rare. And now, 1 in 12 to 1 in 30, depending on what state you're in, is the autism rate for children right now. And we see a large proliferation of mental health illnesses, whether it's anxiety, depression, OCD, psychosis, which are all related to inflammation, by the way,
Mhm.
right? And Alzheimer's was rare decades ago, and now it's so common, right? And so when you start looking at the multifactorial causes, it really is environmental toxins. And these are all the 50,000 chemicals that they've made in the last 50 years,
Mhm.
right? But also the toxic metals, right? I mean, Denver has a lead water problem, and all of the patients that I see who grew up or live in Denver for decades, they all have lead problems. But of course, now the city is, of course, giving people a water pitcher when they move in. But what about all the people who lived there before?
Mhm.
And then, we have all the mine runoff from the mountains and the industrial runoff from, all the industry here. cadmium in the dark chocolate. So there's the toxic metals. And then you just touched on the biological toxins, which, mycotoxins are so ubiquitous, whether it's in Tostitos corn chips or your coffee or
Or your
the
bacon,
mixed
like
nuts that you're
everything.
eating. Yeah, right.
Everything.
And then heck, we have all these resurgence of all these viral problems, Epstein-Barr, HH6, CMV, herpes, after COVID,
Mhm.
right? And then COVID itself is a biotoxin. We
Yeah.
know that the spike protein is, whether it's from being sick or from, getting the, injections,
Mhm.
where it is huge and pro-inflammatory, causing a host of cardiovascular and neurological and immune and autoimmune illnesses. I mean, there's a massive proliferation in cancers right now.
Really? So you're seeing that and you're seeing this trickle down post
Oh,
2020. Ugh,
people have never been sicker,
ugh.
and it's harrowing. But when you think about, so what do we do, right? And I
Because
think
you can
that,
get in the weeds, it can get dark. And like when you think about it, you're like, well, we're just straight doomed. Like why don't we just throw in the towel now? Like what can we do? And that's like how I sometimes I go to work, I'm like, oh, I think we just might be doomed as a society. But then you see change. Like I have a podcast after you about an incredible success story from just addressing the structures of the tongue tie, but also the other factors that go into it. And so health is so multifactorial, and we're looking for the tipping point. Like the
yeah,
tipping point's COVID, the tipping point's mold. How can we control the factors that are uncontrollable from an environmental standpoint? Like we can't move out of Denver to somewhere else that
yeah.
doesn't have lead.
What
We
I would
don't know.
say is there's what the idea that we try to promote at Vivewell Health is, we want to empower people with understanding their own body, so that they can have resiliency to go out and have a lot of fun, right?
Totally.
To help
Okay, you
get
got to
them
keep living. Like there's so
yeah,
much fear with all of this too, especially like
yeah.
living in the Instagram mom space. Like everybody's terrified of everything. And you just got to like step back for a second and say it's all going to be okay. But how can we live the healthiest life possible?
So we start with nutrition. I typically have people, I have a couple of handouts. Get Your 30, which really promotes diversity in your diet. Eat the Rainbow, which is just have lots of colors on your plate, because all those different colors are from different nutrients that you really need. And then we at least start with eating organic on the Clean 15, the Dirty Dozen. But I really tell people to purchase the best food that they can afford.
Mhm.
I oftentimes show people my food inflammatory markers that I had leaky gut and I didn't know it.
Mhm.
And I was actually developing actual allergy to eggs and chicken because I was too cheap to want to purchase organic eggs and chicken.
I
But I'm
bet our
convinced
markers are like
now.
the same because I mean I did that. I was like, ah crap, I'm allergic to eggs. It's like the only thing I could eat.
Sure.
Ugh.
I would say other healthy things about, exercise is really important. And I think everybody has an internal negotiation inside themselves, like, am I really going to wake up early and exercise, or do I really have to this time? So, we actually have a VO2 program where we measure people and help them figure out their target heart rates, with an exercise physiologist so that we can prescribe an exercise plan. I think clean water is another part, right? Where, I learned in Golden, we had 8 carcinogens in my water. And so
Mhm.
we put in a whole house water filter.
Yeah, I live next to a
And
golf course, so that's good for you.
I know, and there's all those data about, all the poisons, the runoff, right? The
Yeah,
organophosphate and
yeah,
the pesticides.
yeah.
I think people don't go outside enough, right? And
Mm,
so making sure you get sunshine, right? And I think there's a big role in just even breath work, right?
mhm.
People live in this constant pressure, faster, faster, faster. And then you realize you're not even like doing deep breathing. And there's a huge role in breath work in our neurological status about the
Mhm.
sympathetic, parasympathetic tone,
Mhm.
right?
And
And
how many
then,
of us are just in fight or flight mode and the cortisol's high and
yeah,
all the things.
yeah,
So,
we're hustling.
mhm.
And I even think mindset is massive. where I really try to live in a state of gratitude and even just being present, mindfulness, right? A lot of us live in the future or the past, and we're always thinking about something else instead of like what's happening right now. And so being present to the conversations and what's happening of, in our heart and in our relationships is huge. So those things I think, are doable. But then advanced testing in genetics and what's going on with my chemistry and having a strategy is there is a way out. And we have a lot of people who they get better and they feel liberated and empowered.
Yep. So, because in your practice, you have a number of different testing options, right? Like you have nutrition genome, which can look at the
Yep.
genetics of the nutrition that your system needs or could benefit from more so
Yeah.
than someone else. You have mycotoxin testing, you have advanced panels. Like there's so many things that you're looking at that's different. Like we just
Yeah.
did a Lyme titer on my son. We've done not a lot of testing on him, which is like super fun to manually restrain him and draw blood out of his body. So that's exciting. But,
Oh, that's tough.
sometimes you got to do what you got to do.
Yeah. Well, I mean, I think it's a heavy lift in the beginning.
Yeah.
And like you said, we actually have come up with a best case scenario for most people and actually operationalize this. And so we actually have a metabolic pathway that
Mhm.
people can talk to our team and say, I want the stuff. I don't know how sick I am, but I don't feel great. And so we bring them in, we do VO2 testing, body composition, gut barrier testing, food inflammation, and we do a total tox. We start people on ozone infusion therapy with, a couple pushes of some lipids and some other things. And they do that a couple times, and then I finally meet with them. We also do some fasting hormone labs. I have a neuroendocrine certification, so I'm always like thinking about hormones as well. But we help people kind of get started in the right direction, and it's slow and it takes months of leaning in on your health, but I think there's a lot to do. Yeah.
But that's the hard part. If you don't, nothing in quality health is a quick fix, right? Because
No.
all we're doing is unraveling years of dysfunction and damage. And it's almost like the older you are, the harder it becomes. Like it's much easier to work to resolve this stuff in childhood. I just heard of a family member who had a recurrence of strep and now is hospitalized and has like severe Crohn's. And you have to think back to what was going on 18 years ago when this child was 1 years old. Was there something
Yeah.
that could have been prevented at the time? And we'll never have an answer, but it's like do the best we can when we know better now, because we know better now and we can test for better now. We're not just shooting in the dark as much anymore because we have all of these access to information. I,
There's hope in any circumstance,
Mhm.
right? We know that health gets worse over time and you have to invest to make it better, whether
Mhm.
that's, investing in purchasing good food and taking time to cook it at home, or investing in exercising or relationships so that you can have friends and love in your life. But we know that the longer you wait, it gets more expensive.
Totally.
That's why we spend half of our healthcare dollars in the last 6 months of life. But you're right. I think if people see something's off in early on, then there's a lot to change, and you can actually change the direction of somebody's life. We recently had somebody, and it's a testimonial that you may see come up on your feed, where there was a guy. He was sick and a Navy vet, and he had some sort of concussive blast injury, but and that just made him worse. But he had a bunch of ringing in his ears and anger onset after his naval initial training, but he got all these vaccines and it sort of triggered him. We ended up doing some things, and at 3 months, he was way better. And his wife came in with him and she said, "The man I married is back."
Aw.
And it was huge. Um, they brought their kids in, and one of their children had a history of just maybe not doing as well. And this was like a 6 month old,
Mhm.
right? And she's like, "I don't know. I just, you know, sometimes you get that gut feeling."
Mhm.
And they had gone to other doctors and essentially been told, like, "Ah, you're fine. That's normal." And we ended up doing organic acid testing on this child, and there was huge fungal overgrowth.
Mhm.
And within days of starting antifungal treatment, her child changed from being this little cuddly, sort of like subdued child to prolific personality and all kinds of pizzazz. And it was really amazing that we unlocked the personality of this, of this little child with just a little bit of advanced testing. But what an opportunity,
For
because
sure. I mean, what would that become, right? Like that becomes a kid who struggles in school, a kid who's bullied, a kid who turns into an adult. And what damage has been caused if we don't catch it early? So
there was
I
something.
think that's what we tell a lot of people is like trust your intuition and ask better questions. And when you're not getting an answer in a traditional medical model, you as a parent should be entitled to ask more questions of someone deeper
Yes,
in the rabbit hole. Like
yes,
I have a pediatrician, I say it all the time, and I adore him. And he probably thinks I'm crazy, but I go, you ready to talk about it yet? And he's like, not quite. But like
yeah,
I need him. I need him for stuff that is I need him to sign my form so my kids can go to school. Like there are certain things that in our current system we have to have. That doesn't mean we can't have other people to support us. And that's really where you come in. Like we're piggybacking so much stuff. And that's been the fun part about referring patients to you too, is seeing the successes when they're doing better.
I think I go back to being a kid and how we have to learn how to play in the sandbox together,
Hmm.
right?
Hmm.
And medicine really is like that. It's a team sport, and so there are a lot of people who aren't ready yet, like you
No,
mentioned,
it's hard. It's a
or
commitment, right? Like, I got like a
there's
gazillion things that I would love to do and could do, but you got to focus on what's in front of you. So, but I mean, you break it down in a way that makes it, and I tell people this too, like when you come to see me, we could talk about the low-hanging fruit. What's the low-hanging fruit and what's the most extreme thing down the line? I, as a provider, ethically feel you deserve to know what your options are. And then you can choose how far down that line you want to start. Most
yeah,
people want to start at the beginning. And that's kind of the same thing like organic foods, get sunlight, move your body, like tone down inflammation in the easiest possible way that you can do
yeah,
day to day without a ton of guidance, like money, yeah, but also not as much as if you let it get worse.
yeah, yeah. Um,
Crazy.
it's been interesting to see you personally and to see your family as well going through all this stuff. Maybe we could talk a little bit more about Pan's Pandas. What do you
Yeah,
think
I
about
would
that?
love to. I mean, that's a deep dark rabbit hole that like I look at med histories and I also look at primitive reflexes because I work with
Hmm.
a number of providers that look really closely at that stuff and I say, I think this is a structural problem, I think this is an inflammation problem, or I think it's a both problem. And that's the hard part is there's so much inflammation out there. So, yeah, let's talk about pants pandas. No one knows what it is. Like everyone says, "Oh, my kid got ear infections, and then they got antibiotics, and then they got strep, and they get strep like only like 4 times a year." And I'm like, "Only 4 times a year?" And then what do they do? And they're like, "Well, they give them antibiotics, and it goes away." Like, what are we missing? What are we not doing well for people?
Ooh, that's a great question. So pediatric autoimmune neuropsychiatric syndrome, PANS, okay, was really they put a label on something several decades ago. And then PANDAS was the pediatric autoimmune neuropsychiatric disease associated with strep. And what these are autoimmune conditions in the brain where there's inflammation and your body's attacking itself. Okay. And in the robust, healthy person who gets a strep throat, their body just kills it,
Mhm.
right? In the immune susceptible person who, for some reason, maybe doesn't has a low vitamin D or not enough zinc or magnesium, or they've got more toxic chemical buildup, or they've
Mold
got
exposure,
mold.
born with Lyme, because Lyme can be vertically transmission, correct?
Exactly. Yep.
Mhm.
Mold, Lyme. Food inflammation, it's gluten for them, right? Or their parents are composting at home and it's just proliferating mycotoxins into the kitchen. There's all kinds of things that can be happening. And so that person who gets a strep throat, the body actually, strep actually has something called molecular mimicry, where it has a sequence to it, a genetic sequence that the body recognizes, creates an antibody to, and it's identical to parts of your body in your brain. And this happens also with Epstein-Barr and COVID and a number of other things, where then these antibodies are attacking you,
Hmm.
right? And so this is the horrible situation where now the crown jewel is inflamed, the body's on fire, and it affects everything from movement, right? And people have, movement disorders, chorea, where their fingers are moving, tics, jumping, making noises, blurting things out. But then also it affects anxiety, depression, OCD is a huge thing. And sometimes people's behavior can change overnight, literally.
Yeah,
So
because there's rapid onset, right? And then there's some that they say is like slower to develop or not as like obvious. Is that correct?
yeah, and like our layer phenomenon, and I oftentimes recommend discuss my family. We my son started having tics and it happened. I remember the first day I heard it, it was like, what is that? And then, I went through this whole rigmarole of, taking him, he got a laryngoscopy, he got an MRI of his head and neck, multiple manual therapists. I saw doctor after doctor after doctor. And it was a colleague who said, maybe it's pandas. And we did a strep throat culture and I mean, his throat looked completely fine. And sure enough, it was a positive strep. And I did some blood work, and holy crap, his ASO and his anti DNase B were elevated. So I started antibiotics, and literally it was what helped, right?
Hmm.
I was doing some antiviral stuff, but things kind of plateaued. And then we dug deeper, and he had elevated mycotoxin markers. And so we worked on that. And then all of a sudden, he worsened. And my kids got Bartonella up in the mountains just this last summer, where I mean, and he didn't have a tick, but it was like the mosquitoes or the flies, in the mountains. We don't know what it is. Turns out all of us got Bartonella, and actually all of us had pre-existing Lyme. So it's layers where all of a sudden you're sitting and realizing that it's the environmental toxins, the metals, the mold, the Lyme that you had, and it builds. And so, for many people, as we unpack these layers, it can be a bit of a rocky road towards recovery. But when people arrive, they have a sense of resiliency, and they're better, but then they understand their health. And our family is completely transformed with how we look at health, what we're eating, and how we're choosing to live.
Yeah, it's tough, but I mean, think of the difference you're making for them as they enter adulthood. Like our environment's only going to get more toxic, more damaged, unfortunately. And we have to set them up for success for the future so that they can have the best opportunity to lead a healthy life. Like that's the
Yeah.
hardest part is where, and I talk to my parents all the time about this. They're like, you weren't breastfed a day in your life and you turned out fine. They're like, you had ticks all over you. You turned out fine. I'm like, yeah, but the difference between fine and thriving is it's there. And so now, like, let's control some things. We also know like Lyme is becoming more and more prevalent. Like you said, mosquitoes, who knows where they got it? But it's scary stuff. So a couple little questions. What do you wish every provider could screen for? Like, what's an easy question for patients to ask to be like, okay, I've maxed out the care that I can receive in this traditional medical model before they come to see you? Like, make the decision because you're not getting the answers. I mean, do they ask about food? Do they ask about nutrition? Do they ask about like peptides? And do they get the no before they come see you, or should they just like take the leap and do a discovery call?
That's a great question. I think every person's situation is unique.
Hmm.
I would say that we tend to look after people who are proactive,
Hmm.
right? And people who are ready to invest. And I think each person has to come to a point in their life when they're dissatisfied with what's going on around them and they realize there can be more. Um, where they've already started to wake up to the idea that things aren't okay, right? And I think I had to come to that point as a physician that I was ready to seek after other things because I wasn't okay. And so we talk about this internal negotiation for your own personal care. I think that's sometimes difficult for people. When it comes to children, I think it's a different story because as parents, all of us want the best for our kids. And if any parent who hears this or in your practice has a concern that somebody else isn't taking seriously, then you owe it to your kid to come see someone who is actually going to spend time. I mean, I take an hour on every single new patient consult to really get into the weeds with them because I see this as a 911 call in somebody's life, and I'm not going to just push it under the rug. And like you said, when we come up with a plan, it is a robust plan. Like if this was my kid and you had one shot to talk to somebody and say, here's what's possible, I'm going to show them what Ferrari healthcare really looks like,
Hmm.
right? And they don't have to do it all, but we're going to talk about stem cells and exosomes and all the cool stuff you can do. But let's start here. But I want them to know that if they want to pull out all the stops, that we can do that.
Yeah. Well, that's like we're trying Trudeau's on my son next week. We'll see how that goes. I'm going to spend a lot of money at the Lego store after, I think, in terms of bribery. So, but like, why not give him an opportunity to treat inflammation the way that we could? Like, it's a battle. It's all a battle. So,
It's
um,
incredible,
yeah, pros
right?
and cons
And
to everything. So,
well, but your body was made to heal,
mhm.
right? And his immune system is under attack, right? And we've talked about flares and whatnot, and he's on
Yeah,
this
so
course of
my boy has
medicine.
pans pandas for those that aren't, because, he, and a lot of people have heard my story, but born with ties, treated the tries, expansion, tonsil adenoids, more expansion, treating structures, and then finally looking at reflexes and inflammation and diving deeper into the onion because we have to. Like some people are better with a tongue tie release only, and then they thrive from infancy into adulthood, but some people need more just based on all of the other factors that have been thrown at him in life. And so, like, we've discovered a lot of stuff about him. And like you said, we've discovered a lot of stuff about ourselves and in our family. And so now it's just mitigating the risk for the future, treating what's in front of us.
I got a lot of hope for our families, but
Mhm.
for the many people. We've seen people who are nonverbal start to talk,
It's
right?
amazing.
We recently had somebody who their child was essentially pronounced brain dead at Children's, and the family they were like, well, you should do hospice for your infant, and they're like, what are you talking about? Who they're now much more functional. People who this other premature infant who had really poor retinal development and was basically stuck on oxygen. And the people at Children's, they wanted to put a trach in this kid. And, she came in and we did exosomes and stem cells. And within 3 months, the kid is like off oxygen during the day. Just amazing stories of people who just decided to get a second opinion.
Yeah. Well,
And
and to wrap up, I think it's important to highlight how research is going to be behind functional proactive medicine and dentistry forever because it
yes,
can't keep up. And to isolate all of these circumstances and to say this one thing is what made the difference. Like it's not possible. And I see that a lot in the ties space. It's so controversial on the really traditional medicine side because they're like, well, there's no research. And it's like, well, are we going to withhold beneficial treatment from someone? And are we going to be able to isolate this one factor 6 years into life when we knew it existed and we didn't treat it? Like you see the same thing in your space all the time, I'm sure. And I'm sure you get some haters that are like, where's the evidence? Is it FDA approved? And you're like, it can't get there because of the regulatory stigmatization and stipulation that's there.
Well, two final points. I think the research is there for most of this stuff, and this is a field called translational medicine, where there are dump trucks full of like bench research articles that are there substantiating the physiology that we're doing, and we're taking these ideas and putting it into clinical practice. And many of these are therapies and treatments that are used globally, right, for decades. And so I think there's a ton of research. But then we have to look at the pharmaceutical, industrial, business structure that the FDA, the AMA, and the NIH and the CDC that is forced upon the people. I think we all see the revolving door between big pharma and the FDA, and that it takes $500 million to bring a product to FDA approval. So a lot of these things are never going to see the light of day, but people know about them. And as AI and research is becoming more mainstream, I think research backs what we're doing. To be honest with you, this is the most advanced healthcare possible, and it's a lot of fun to be on the leading edge, leaning in, looking after people in a way that's really epic.
I love the term translational medicine because, the Institute for Functional Dentistry just launched. It's a really exciting time because there's so many people like you and I that are looking to collaborate and coordinate. And we haven't yet had the systems in place to really make that happen because we didn't have a name behind it. So Institute for Functional Dentistry exists to go along and complement the Institute for Functional Medicine. And I think that's the way patients want to see their care going. So I'm really optimistic for the future. I'm so hopeful that we can all continue to do what we're doing and just keep doing new, better stuff because it's out there. So, and like you said, it's research back. Like what we do is research back. It's not made up. Like breathing is important. Breathing isn't new.
Well,
it's tough.
Liz, you are head and shoulders above most of your peers, and you're obviously a brilliant woman who's really talented. And I think your patients are very fortunate to have such an exceptional doctor taking care of them. So I appreciate you bringing me on your show to share a little bit more about what I do, but I'm really looking forward to every conversation we have.
We'll link the practice in the show notes. We'll make sure to continue to collaborate, and I'm really excited to keep working with you in the future.
Yeah.
So on that note, thank you for joining us on No One Told Me, the Airway Health Connection. Dr. Ben Busch, thank you so much for your expertise and all you do for pushing medicine in the right direction.
Thanks for having me.
Thanks for tuning in to the Untethered Airway podcast.
If today's episode helped you see things differently,
please share it with someone who would benefit from hearing this. And don't forget to subscribe.
Want to learn more about Airway Health or connect with our team?
Please visit our website, untetheredairwayhealthcenter.com, or follow us on Instagram @untetheredairway.
Until next time, bye.